We're getting confirmation as we look to the coronavirus coverage that 39 more people aboard that quarantine cruise ship docked in Yokohama, Japan, have tested positive for this new virus with the new name. Get used to hearing COVID-19. We don't know what countries they're from. They haven't listed any nationalities this time, but we do know so far that 8 Canadians are among the 135 passengers and crew who were previously taken off the Diamond Princess and are receiving treatment in a Tokyo hospital. So 39 in addition to that 135. The ship outbreak, the largest anywhere outside China. And we're going to talk about that in just a second, but there is a little bit of breaking news. Dr. Samir Gupta is with us this morning, and here's some breaking news as we turn to a conversation with you. We're just hearing this morning from Dr. David Williams, who's Ontario's Chief Medical Officer of Health, confirming that Ontario's 3rd case of this new COVID-19 is now resolved. So this is the word they're using, resolved. This was a confirmed case in London, Ontario. And what we're hearing from health authorities is that individual had 2 negative tests at least 24 hours apart, therefore considered to be resolved, no longer infectious with this COVID-19. So that is some good news. And we know the first 2 patients also cleared in that regard. But Ontario has dealt with 3. I was alluding to Dr. Gupta. He is back. Dr. Samir Gupta, after some work travel abroad. Good to see you. And coming back, you left when we were talking about the story, still talking about the story. And in particular, we've been focusing a lot on this cruise ship with more than 250 Canadians on board, because it's telling us a lot about this new coronavirus. 39 more cases overnight. What does that tell you?
So I think, generally when we think about a cruise ship, it's a kind of unique situation. You've got thousands of people who are interacting very closely in basically an enclosed space. They're sharing the swimming pool and the dining facility, the entertainment facility, they're sharing bathrooms. So if you have any type of vector, any type of infection on a boat like this, it can spread very quickly. We know that because diarrheal diseases can spread very quickly on cruise ships.
Like norovirus and that kind of thing. And we have also had a lot of Legionnaire spreads too on cruise ships.
We've had these outbreaks, so this is not surprising. And there have been, several cruises have been canceled. There have been 4 ships that have been affected by this. 3 of those we don't have confirmed cases, but there's concern. And then we have this one Diamond Princess that is docked off Tokyo. And what we're understanding here is that it seems to be accelerating very fast in terms of the rate of new infections being identified. Somebody got off this boat in Hong Kong and ultimately tested positive. And after that, they started looking for it on the boat. And as you said, we now have 175 people on this one cruise ship that are infected.
So 39 cases confirmed overnight. What does that tell us about this virus and its spread, in particular, the rate of spread?
Yeah, so that's worrisome in terms of how infectious it is and how easily it spreads. We also have now some new information about healthcare workers. So there was a study published in the Journal of the American Medical Association last week. And that study tells us that they looked at 138 patients who were hospitalized in China with this virus. And 40% of those people actually caught the infection in hospital. 30% were healthcare workers, and about 11% were just other patients who caught it. And so that's quite frightening in terms of thinking about, similar to SARS, how a lot of healthcare workers are getting infected. And that could be, there's several possible explanations. One possibility is that it's the kind of virus that sheds a lot, that's released a lot from the body when the person is very sick. Not all viruses do that, but if it does do that, healthcare workers are obviously at risk because they're taking care of the person when they're most sick. The other possibility is that it's spreading in ways that we don't understand. So maybe our protective equipment isn't effective for this. But I think the more likely possibility is that it was just not picked up early, particularly early on in this epidemic. People came in, often we now know that it has a long incubation period. So 2 weeks, you might not have symptoms. You might still be infectious for part of that period. A lot of people have very mild symptoms, like just a stuffy nose. And then also we know from this report that about 10% of people will have non-respiratory, so diarrhea, nausea. You might not suspect that person has this particular infection. So early on, they may not have been isolated. And it may be that it spread not so much because our protective equipment is not effective, more so because people weren't wearing that protective equipment early in the epidemic.
Didn't realize that. We certainly know in China, hundreds
Right.
of healthcare workers have been affected by this. They have developed the new coronavirus as a result of this. In Britain, a couple of cases just the other day as
Yes.
well.
Yes.
We haven't heard about that in Canada, thankfully. We certainly did during the SARS time.
Yes.
But I mean, we're looking at pictures as you're talking,
Yeah.
fully gowned though, with
Yes.
face shields and everything. These are not the things that healthcare workers would be wearing.
Right.
It's
Right.
even beyond that, is it?
Yeah, so typically, I think it's important to sort of clear the air about, or so to speak, clear the air about how this is spread.
Right.
And as you know, as you mentioned, I was traveling. And so one thing that struck me was that I was in the UK and I was in India. These are countries that have just a handful of cases in people from China, not local transmission. Yet I saw lots of people at the airports and on the airplanes wearing masks. The reality is that people really shouldn't be doing that. It might cause more harm than good. So we think the main route of transmission is droplet spread. And that's how many of these viruses spread. So when I sneeze or cough, or even when I talk, these tiny particles, these tiny droplets come out, and they can carry the virus up to about 6 feet. And somebody else can be exposed because it can hit them on the eye, the nose, the mouth, or they can breathe it in. And that's how you would get a direct transmission.
Okay.
Sometimes these droplets might also land, for example, on the table. And we don't know this for sure, but this virus might be able to survive outside of the body for an hour, maybe more. Somebody comes by, touches that table, and then rubs their eye. They've got the infection. That's probably how it spreads. Now, what we heard a couple of days ago from a Chinese official is that it also spreads through aerosol. Probably that isn't true. But if it is true, it's a game changer.
I mean, just talking to WHO scientists just a few minutes ago, it's very clear they still don't know. They don't have a definitive picture about how this spreads and how easily.
Exactly, and so we're extrapolating from other coronaviruses. But aerosol is a totally different
What
route
does that mean,
of transmission.
aerosol?
So it means that instead of traveling in these sort of heavy droplets that we produce, the virus actually gets aerosolized, so it gets suspended on these microparticles in the air. And so that's different because if I cough now and it becomes suspended, it hangs in the air and someone can come by an hour later, I'm no longer here, and they can catch that infection.
That's worrisome.
And that's, you have that, that's infrequent. You have that with measles, you have that with tuberculosis, but you don't have that with most viruses. If you have that, obviously it's a much more dangerous and worrisome form of spread.
Right.
We also know that from a couple of reports in China and the US that the virus is present in diarrhea. So direct contact with diarrhea could be another form of spread.
These are the things that they're looking at, but you brought in masks to show us when you say that it could do more harm than good.
Exactly.
What do you mean by that?
So a couple of different mask styles. So this would be your typical surgical mask.
I'm seeing people wear that on the streets and in subways and things
all
like
over the
that.
place.
That
And this
very
is a
model.
barrier mask. You've got a couple of loops. You put them around your ear. You bend it around your nose here. And what this does is it protects from those droplets. So somebody coughs and the droplet hits the mask instead of hitting your face. And so you won't catch the infection. And for most viruses, this is very effective. A couple of different styles. You've got a pouch style as well. For healthcare workers, though, because again, we don't know for sure about aerosol transmission, we might use a more sophisticated mask called an N95 respirator. And here's an example, and here's another example. What's different about this is the 95 means that it blocks 95% of microparticles. So it really is a different filter. It's filtering these tiny 0.3 micron particles.
Okay.
And so
I'm sorry, I have to let you go, but but are you suggesting, I mean, we're not at the point of people having to wear these masks, are we?
absolutely not.
They keep saying the risk is low.
The risk, we don't have it in our population, and the harm is that I'm seeing people put this on.
Right.
Obviously, this is the surface that's contaminated, but people are touching this surface, people are, putting it over their head, putting it in their pocket. The idea is this is a one-time use type of mask, and so people are paradoxically possibly spreading the infection more by manipulating the mask and touching their face.
Isn't that incredible? Even though we know the shelves of mask supply stores are empty with people trying to do those. Thank you so much. Obviously, we're still learning a lot about this, and thank you for helping us understand what we're seeing on the cruise ships and what not to do. Do not wear one of those masks. All right. Thanks a lot, Dr. Gupta, Dr. Samir Gupta, who is with us often. And officially, he's a respirologist and associate professor at the Department of Medicine at University of Toronto.